question.
That's beside the point.
Yeah.
And is everybody all good to
I am
go?
just and I'm going.
Can I have her scoot over 6
Yes.
inches
Oh,
that
do you
way?
want? Do you
Her-
want?
her-
Oh,
You haven't
actually-
done this before, so do you have any questions for us before we
And
dive
then
in?
I'll
Not really. I
Okay.
mean, I've seen a lot of interviews, so I assume, do you
It's-
ask questions, I answer, and
Yeah, it's pretty informal, just
Yeah.
like a conversation. Like, don't worry about them. And then Amelia, do you mind scooching over like a few
Oh,
inches?
yeah, sorry.
No,
There you go.
you're
You're
good.
good,
Actually,
you're good.
actually, yeah,
Yeah.
not too far, but you're good. I
You're
think.
good, yeah, you're good, you're good.
Okay, cool. Okay, so I guess, do you mind just introducing yourself, kind of telling us a little bit about you, your
Sure.
name, what you do?
Sure. So my name is Sarah, but I go by Mo at work. It's kind of a nickname. And when I started here, there were, I think, 6 or 7 different Sarahs. And my name looks like Sarah. I spell like Sarah, but I pronounce it Sarah. And it was just this whole thing to introduce myself, 6 to 8 times a day of Sarah. I felt like that's ridiculous. Mo is easier. My patients will call me. Family members can remember it. So, yeah, I go by Mo. I've worked in the ICU my whole nursing career. I worked in Salem for 2 years. And then I came up here in 2015, and I've been working in the MICU since then. And I feel very blessed to be here. We have like amazing culture on our unit for what we deal with, even pre-COVID. It's been a very difficult unit, and I think if anything has shown us during this last year and a half is just how resilient we are and how we all look out for each other.
For people who aren't in the ICU every day, who may not be in the medical field, give us a sense of what people don't see. What you guys see that might be jarring, I don't know, but what might be really useful for other people to know.
Yeah. That COVID doesn't discriminate at all. COVID doesn't care that you're a good person. It doesn't matter what nationality you are, where you're from, what your beliefs are. If you're a good neighbor, if you're a good daughter, if you're a good son, it affects everybody. And we've all have seen a lot of deaths, and it's very, very, very sad. Because for a lot of these people, it's preventable. And all the patients that we're seeing right now, they're all COVID positive on our unit, and they're all unvaccinated. We are closely in touch with family. We're updating family members or meeting with them. We're witnessing family members see their family members go through this. And you ask them if they're unvaccinated or vaccinated, and they are not vaccinated. And it's frustrating because I think people have this kind of me complex or me syndrome, that it's not going to happen to me, it's not going to happen to me, it's not going to happen to me. And it's happening to people. And, I'm old enough to know that I can't convince anyone to do something that they don't want to do. It's really sad, and it's angering to see that people are being affected in a way that they don't need to be. And it's almost like a choice.
Quick question for you guys. Are you getting some new background noise?
It's a little, it's like air, right? Is that what you're?
Yeah.
HVAC? Sure.
Yeah, it's 8 or water, something run through a pipe.
There might be a restroom.
I mean, it's not big enough on my mic. But
Okay.
Are you?
I'm getting it, but I think we can knock it out.
Okay.
Okay.
Can I ask a follow-up to
Yeah,
that?
go for it.
It just occurred to me listening to you talk that there's this divide in this country right now that expresses itself in a lot of different ways. But one of those ways is whether or not people choose to get vaccinated. A lot of it, there's a bit of political aspect to that often, and that very few people are working or talking to people on the other side of the divide, and that because you're charged with caring for people who get COVID, that you're having these conversations with their family members, and you're kind of, not only are you doing this unbelievably challenging work with people who are very sick and may die, but you're also some of the few people in this country that are really having to have serious conversations with others who have a different set of beliefs around this illness. So I guess what is that like, and how do you what do you wish those people understood about you and the work that you do?
Yeah. Well, it feels really frustrating and angering because this is a medical issue, and it seems like something medical or what a medical policy could have fixed or helped has now become completely political, and everyone has their own opinion about it. But when you're sick and you go to the doctor and the doctor says, hey, you have this helps. Most people will do what it takes to help themselves. And it just seems like that has been taken out of the equation. And in place of that, there's been a lot of opinions. I'm sorry, I can't remember the other part of your question.
No, that's okay. Just what's it like sort of having conversations with family members and being in the middle of this struggle?
Mm-hmm. So yesterday, or not yesterday, the day before yesterday when I was at work, I had yesterday off. I dealt with a family member, and he's a very young man, and his dad is dying and will die, and he's not going to make it. And so his family was coming to the grips of that reality. Part of his family was in denial of what's happening, and the other half wasn't. And I asked him if he was vaccinated. He said no. He has a very, very young child and family, and he gave me a lot of reasons as to why he didn't want to do it. And I hear this a lot. It seems very controversial. I'm waiting for this other vaccine to come, and people don't realize that they've been working on this type of medical advance for over 10 years now, and this has just been the chance for them to use it, and it's worked, and hence why they were able to come out with this vaccine so fast. And we just talked, and it was nice to have an open discussion with him, because some people do not like to talk about things, and I think that's all we can do is try to have as much open discussion as we can. But it's hard not to feel like this is the epitome of privilege, right? In this country, we have the privilege to get this vaccine, and globally, people would do anything for this vaccine, and they don't even get this chance.
Is that something that touches you personally? Do you have friends or family who are who don't have the same access to the vaccine that privileged people in this country do?
I do. I have family in Iran. So it's hard. And they're talking about reboostering here in the States, even though really global action is really what needs to happen. Because we're just going to continue seeing this cycle over and over again until we see like a united effort, I feel, for humanity versus just nationwide.
So you talked a little bit about how there are people in the world who, would do anything for the vaccine. Were you referencing your family in Iran?
Not personally, but sure, yes.
Oh, I
Yeah,
was just curious,
yeah.
Have they been able to get the vaccine?
No, they have not been able to get the vaccine.
And you also talked about how people, it's a very me complex, right? Okay, this isn't going to happen to me, this is going to happen to me, but then it's happening to people.
Mm-hmm.
Have you found yourself, I assume you have, what's it like being with a person who is, the writing's on the wall, they're going to die, and there may not be a loved one there, but you're there. So what's it like to shoulder that kind of care and responsibility to this person who is on their deathbed?
It's a lot, but I come back to the fact that what would I want my loved one to, like, how would I want my loved one to be cared for? If this was my mother, my father, any of my family members that, because of hospital policies and protocols, that I couldn't be there for them, how would I want them to be treated? And so it's just, a flood of compassion comes out, tears, sadness, a lot of empathy for them and their family members. Yeah, that's all we can do is be there for them when no one else can.
Amelia and I, we were talking about how in the ICU, there's just, even pre-COVID, people die.
Yeah.
And there's serious,
Mhm.
you know, things that happen. And, you know, nurses, you guys are
Yeah.
superheroes. You deal with it.
Yeah.
How is COVID different?
COVID is so multi-layered. Like when it first happened, you thought like, oh, we're just dealing with the medical part, right? But then there's like, you go home and then there's the politics out there, and everyone has their own opinions. And your life, your personal life, all of our personal lives have been affected. And being so close and having such strong education here, I mean, we're lucky we have PPE, so I've never had to worry about my safety at work. You know, I know my family is worried. Oh, I'm so nervous for you, I'm so nervous for you. I'm like, don't be nervous for me. I have everything I need. I know exactly who's I need to be, you know, at risk for. I'm worried for you when you go to the grocery store. I'm worried for you when you step out and you go to the bank. Because you don't know who you're interacting with. You know, you don't have the right PPE that you're wearing that we should all really be wearing. Yeah. It's tough. It's really hard. And prior to COVID, we had a really high mortality rate here anyways. But with COVID, because it's so multi-layered, and we all, you know, I have my own opinions of how I feel, and it's hard not to let all of those things inundate you in the moment when you're at work, right? Somebody has a TV on in the room, they're watching the news, there's a lot of opinions. It's a lot more multifaceted than I would have expected to have to deal with at work.
So it sounds like what you're saying is you're already dealing with like the intensity of being with people who need either really complex care and are dying,
Right.
which is kind of what you signed up for as a nurse.
Right.
But you're also dealing with this like incredible conflict
Yeah.
that you can't escape, that's related to your work.
Yep.
And that you've kind of been thrust into the middle of.
Yep. You know, being a nurse, everyone wants to ask you your opinion about things, right? Even pre-COVID. What do you think? I have these symptoms. What do you think? Go see your doctor. Go see your doctor. But now, you know, in some ways, because we're at kind of the front line of all this, we have some expertise on this. And when you talk to people, sometimes they don't want to hear what you have to say, even when you're telling them the reality of the situation. They just don't want to believe. Because it's scary. Like what we see in there is really scary. And it's really sad. This is reality. And some people don't want to accept that reality, which I understand because it's a very sad reality.
Can you just describe that to me? Like, what is the reality that you're talking about that you see in there? What's the reality of what's happening?
The reality is that out of all of our patients, they're all COVID positive. The reality is they're all unvaccinated. The reality is a lot of them will die. And if they don't die, they have, you know, unrepairable damage to their lungs. Their lives will be forever changed. You know, we don't even know how long they will live for. Families are affected, you know, positive and negatively. People are losing, you know, loved ones. Their children that won't see their family members again, never have had a chance to meet them. You know, there are moments where you get very zoned into your job in the moment and you can be really present and just do your task at hand, but really the bigger picture is always there. That this is COVID, or this family member is unvaccinated, and they're not accepting the fact that their loved one is dying. And you know, part of our job is to also be there for the family members and to help them during this really intense, tough time. That's what I love about the ICU, right? Where you're doing all this critical thinking, you're trying to make the patient better, but at the same time you have this component of family and help them go through this very intense process. No one ever thinks they're going to come into the ICU. No one plans on coming to the ICU.
You talked about how it's so scary
Yeah.
in there. You know, people just don't realize it.
Yeah.
I think sometimes when we talk about death or the ICU, because people don't have immediate experience with those things, they're sort of in their head, like vague, maybe. How can you kind of illustrate for us the scary things that you're talking about that might help people understand the reality? I mean, we talked about the reality, the, you know, 100% of the COVID patients you have are unvaccinated, all these things.
Yeah.
But when you say it's scary, what do you mean? What do you see? What are the things that you see that people don't, that is scary.
So people are sedated because they're intubated, so they have a breathing tube down their throat, right? And so then to make them comfortable, we have to put them on medication to make them comfortable. That has a slew of side effects. They're most likely septic, which means they have like a systemic infection from COVID. So now their blood pressure is low, then it can affect their kidneys, so they can have kidney damage. So now we're putting them on multiple medications to keep their blood pressure up. You know, their kidneys take a hit. They might need temporary dialysis. Maybe they'll need continual dialysis, meaning like they're getting dialysis 24 hours a day, 7 days a week until their body repairs. They're having fevers up until like 100, 102, 103. So then we're trying to control that with other medications or, you know, keeping their body physically cold. We do as much as we can to keep somebody comfortable, but there's a fine line between like overly keeping somebody comfortable and not keeping them enough comfortable. You know, people have to continue to have their bodily function, so they're urinating through like a Foley tube, right, catheter. So they have a catheter up their peri area, be it vaginal or penile. They have to have continual bowel movements every day, so you're giving them medications, have bowel movements, and you're trying to maintain their integrity and their humanity during all of this, right? Because most likely they're not going to remember it. You hope they don't remember it. That's the goal. And in some ways, depending on how things are going or how long families are willing to let their family members be hooked up to all the machines, it can feel like their bodies are being tortured. It's hard, you know, for us, we see a lot of this. You can see imminent what's happening, but if, like you said, if you haven't been around this, you don't know what that looks like, and emotions take over and you're not willing to let go. And unfortunately, there's a lot of ethical things that happen, right, that we all struggle with.
Seeing this every day, I mean, you know, being an ICU nurse, even pre-COVID, it's been tough, but now even more so. What has been the mental, emotional toll on you personally? How do you practice self-care, you know?
When I'm not here, I just really am with my family. We're camping a lot. In the winter, snowboarding, like just trying to be outside as much as possible. But I've noticed that for me, it's been a roller coaster. Like some weeks, some days, I do really well. And when I'm not here, I don't try to think about it. I don't try to talk about it. I try to maintain that space. Other days, my patience is low. And I feel sad. Motivation is hard. Some weeks I'm doing great and I'm doing my workouts and going for my walks and my runs, and other weeks I have these runs where it's not as easy. You know, like talking to a therapist has helped greatly, just to talk about things. Talking with my partner has helped. He's not in the medical field, which is kind of great because then we can just talk about everything else that it involves. I have a toddler at home, so I appreciate that because he really helps me stay in the moment, right? And the idea of like now. But it's hard not to be worried for them, be worried for my family, be worried for my child that doesn't have a vaccine yet, you know?
How do you bear that? How do you bear knowing you're taking on all this? I mean, I know you said you feel safe because of the PPE and you've been vaccinated, but you have some risk, and you're, I don't know, it just must be so hard that other people are willing to do a little more to help you guys out, given that you're putting yourself and your family on the line in some ways.
Yeah, I don't think people see their choice as that, right? And I think that kind of goes with the misunderstanding of things, you know? I think people think, well, it's not going to happen to me. Then if it does happen to me, it's okay. I'll get medical care and I will be okay, and then I'll come out of the hospital. And for some people, they get COVID and they're sick for a few days or a few weeks. And for some people, they die. And when our health system gets inundated with this many people in such a short amount of time, people don't understand that when you need to have medical care, you might not be able to have like the high level of care at the right amount, like at that time that you need it, because there might not be a bed available, there might not be a ventilator available. And so, yeah, it's just, I think, unfortunately, a lot of misunderstanding and miseducation.
One more question.
Did you have?
What are you most proud of in terms of what you've done in the last year and a half?
Wow, that's a good question. Can you take a moment to think about that? I'm most proud of the fact that I have been able to still be vulnerable. I can say, like, oh, I've been strong through all of it. That I feel like we can all do that. We can all push. But really, there comes a time where you can't push anymore, and you just have to accept, like, I am angry today, or I'm frustrated today, or I'm really sad today. And I think once you accept that vulnerability, it then makes it easier to do what you want to do, because you're accepting that, okay, it's okay that I'm sad today, and it's okay that I'm angry or frustrated. This is just what it is, and that's okay.
Allow yourself the humanity that
Yeah.
you are giving other people.
Mm-hmm.
Is there anything you want to add we haven't asked you about?
Do I want to add? I don't think so.
Okay. Well, thank you so much.
Thank
And
you.
and if I could just get you to spell your
Sure.
name so I have it.
Sure. So it's Sarah. My last name is Mokhami.
Okay, perfect. Sounds good.
Thank
So
you.
much.
Thank
Mo.
you.
Thanks.
Appreciate your time.
Yeah, I appreciate